Now you can simply try to pause this video and you can try to find out what could be this problem in this ECG. Now when we zoom in, we can see that this is lead 2, and in lead 2 what we can see from starting to end is there is a P wave and QRS, there is P wave and QRS, there is P wave and QRS, this is T wave, and after that there is no P wave, there is no P wave for a really long period. Now actually the P should come around here at this. So if we calculate, there is one large box, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So there are around 10 to 11 large boxes where there is no P wave, there is no QRS, there is no T wave. So the most important thing that we must know that if there is P, then only there will be QRS. If there is no ventricular escape rhythm, if everything is coming in line, if the rhythm is, if the sinus atrial node is working properly, the P should be followed by QRS complex. But in this phase, we are not seeing any P wave for complete 11 large boxes. We must know one large box is equal to 5 millimeter. So total 25 millimeter is equal to 1 second. This is the normal speed through which this rolls. So 25 millimeter means 5 large boxes, so 10 large boxes means 2 seconds. So there is no any P wave activity or atrial activity for whole 2 seconds. Now whenever it comes to the calculation, we must know, we label it as sinus pause if there is no P wave activity or there is no atrial activity for less than 2 seconds, means less than 10 large boxes. So in this case, this there is no sinus activity or P wave activity or atrial activity for more than 10 large boxes. So we can label that this is a sinus atrial arrest. So this is a very typical feature, one of the most important things that we should always remember, that this sinoatrial arrest or sinus pause can be very much commonly seen in medical practice, especially in hyperkalemia. It's very common. That can be because of CKD, AKI, sepsis, anything leading to the hyperkalemia can very commonly cause sinoatrial pause or sinus arrest. In this case, one of the most important findings for hyperkalemia that we should always think, that we should always look for tall, tented, peaking, symmetrical T waves. These are very important. And after that, what we see is there is loss of P wave and QRS widening. After that, the patient may anytime have VT, VFib, or cardiac or systole, and very patients commonly may also land up in sinus wave or sine wave pattern. So in this particular ECG, we can very crystal clearly see the tall, tented, and symmetrical T wave. Why this is very important? We must always know this is tall, this is tented. Tented means like tent like, symmetrical, because if there is a normal, you can also see tall T waves normally also, but this will be asymmetrical. So that asymmetrical T wave will be like this. So if you divide this T wave, this will be asymmetric. But in hyperkalemia, you see perfectly symmetrical T wave. So this is this. So from exactly mid, you can see that this T wave is perfectly symmetrical. If you see this, this is exactly symmetrical, and that holds true everywhere. So this is exactly symmetrical. So there is symmetrical tented peaking T waves with cardiac arrest highly suggests that this patient may have hyperkalemia. This particular patient had sepsis, shock, hypotension, which lasted for a few hours. This patient landed up in acute renal failure, acute kidney injury, and this patient's potassium was around 7.7, and he was showing this rhythm after dialysis. This rhythm completely reverted within normal limit for normal sinus rhythm within 2 to 3 hours after dialysis. That's all for now, and thank you.